Hi, this is Marty Mueller. I'm just recording a quick video. This is really very outline format to discuss or to identify um, 8 ways that we can increase access to palliative care. Um, okay, so the first thing that we have to improve the education of healthcare providers, patients, family, and the public. At the bottom of my references is uh, a site. Let's see. I got it off the mypcnow.org blog with an article by somebody by name Kate Myers discussing how we need to talk more about palliative care and we need to choose our words carefully because too often it um, it sounds like we are stopping care, halting care, rather than revising the goals of care with positive positive benefits for the patient. Okay. Number two way of getting of improving access is getting patients to prepare advanced care directives. There was an episode about Alzheimer's on 60 Minutes Sunday, where if they had had advanced care directives and the family had talked about nursing home care when the patient had better language skills, the husband would not have been in such a quandary and about what to do when she started being confused and not eating and then having incontinence problems, etc. Okay. The third item would be look at where palliative care takes place and expanding or moving on from inpatient sites, which we have 60–70% of the hospitals in the country working with that, to more ambulatory care and home care. Uh, Palliative care programs, and this would include the use of telehealth for rural programs. Number four would be we need better billing and reimbursement um, codes and more generous or better billing codes and easier to bill codes so more providers will take time. One of the things I cited in my previous presentation was they gave an incentive program in Massachusetts to providers to do more advanced directives and more advanced um, care counseling, and the use of palliative care tripled. Okay, on to, I believe we are on to number 5. We need more data to validate how palliative care decreases healthcare costs while improving a patient experience. On to, let's see, this is going to be number 6, I believe. We need increase insurance coverage to encourage more home care when it is appropriate for palliative care patients. Number 7 is um, from one of the lectures from the workshop that was online last week, is we need to look at guidelines or pardon me, regulations for palliative care and quality metrics for palliative care as guidelines for good care, not admonitions uh, so that we don't overuse services. On to, I believe it's going to be number 8. Um, Palliative care needs more of a presence in the media. For example, if there could be expanded articles on palliative care in relation to the decisions that Barbara Bush made towards the last week of her life. She would have been a candidate for palliative care maybe a year ago. One article said that she's been hospitalized in the past year, and I don't know if someone could give examples of discussions that would looked at more options for her. And as I said, there need to be more discussions in the media and in small group discussions like at senior centers or through home care agencies about more than advanced care planning, but what kind of care do people want? Um, what kind of home care can they afford? What kind of care can they get? Or at what point do they want to go to the nursing home? And think about and things that are mentioned in 5 wishes. Okay, that's it for me. I just checked my hand up. Thank you.